Hello, everyone. Help me welcome the very interesting Kim Vopni to the podcast today. So, some of you might be familiar with Kim. She's also known as the Vagina Coach, which I do want to talk about that, Kim. And seems to be making waves across social media now. But Kim specializes in pelvic health, and she's just a wealth of knowledge. And I'm going to let you, Kim, if you don't mind, just tell us, how did you even get into this area? Because it's such a specialized area, but to also call yourself the vagina coach is quite bold. So how did this all come about?
Yeah, thank you very much for having me. And this is always the question that people ask first because, it's not like I grew up thinking I'm going to be a vagina coach. I could argue it started when I was younger. I saw my mom, you know, stopping certain exercises. She had bladder incontinence, had surgery for it. She had chronic back pain. I had also seen a childbirth video that sort of scared me. And so I grew up thinking I was never having kids. And then when I decided I did want to start a family, I was determined to have a different story than my mom. My midwives had recommended a product to me called the Epino, which is from Germany. And it's a biofeedback device that helps, it kind of facilitates sensations that you will experience during birth. So it's trying to mimic, obviously to a lesser degree, what you will experience during birth so you can train your pelvic floor to respond appropriately. So it made sense to me. I purchased one, had a great experience, and said, why doesn't everybody use one of these? And contacted the company and said, could I be a distributor in British Columbia, Canada? And I didn't intend for it to be a business. It just, obviously now we're 21 years later, and that's kind of how it started. But so initially I was working primarily with pregnant women and new moms, and I was a personal trainer and I was applying fitness principles to the pelvic floor. And my brand at the time was called Fitness Doula. And that was great for prenatal postpartum.
Hmm.
I started a second business called Bellies Inc., where we were optimizing postpartum recoveries. And then I started to go through my own perimenopause journey, which I didn't know the term perimenopause at the time. I didn't know what I was experiencing was that. And now I'm on the other side, postmenopause, and there's a whole other chapter really of pelvic health during that phase and beyond. And it was a recognition of pelvic health is not just here's how you prepare for birth or do some Kegels after you've had your baby. It's really a lifelong journey that we have with it. And so I knew I needed a bit of a rebrand, and fitness doula wasn't resonating so much with the menopause population. And I was speaking to a group of women entrepreneurs. This was I think about 8 years ago now. And my talk was how optimizing your pelvic health can make you a better mompreneur. So it was a group of mompreneur
Hmm.
at the mompreneur conference. And all the speakers at this conference were some sort of a business coach, strategy or marketing or finance. And so I joked when I came up on stage, I said, now you have a vagina coach for your business. And that was the light bulb moment where I said, okay, I'm going to step into this really uncomfortable word and it will be memorable. It's getting people to pay attention where I want them to. And that's how it started. And so that was about 8 years ago when I made that shift. And that was, I would say, when things expanded, evolved. I was now working more with perimenopause and postmenopause women. And also, I had a few challenges with social media because vagina is inappropriate, so I had to battle with that. Now it seems like the reins have loosened a little bit and I have more freedom with using a proper anatomical term. And but
That's probably
that's how
why
it
we're
started.
seeing you more, though, as well, would you
Yeah,
say? Yeah.
yeah, yeah, for sure.
It's geez, it is such a bold name to give yourself. It's almost like, I think we agree, everyone agrees, there's a movement happening now in women's health and hormones, especially around perimenopause. But by calling yourself the vagina coach, you're almost like, hey, we're here now. You need to recognize them. We're not going anywhere. Like you're shouting from the rooftops. We're not going to be embarrassed. We're not going to be silenced. And it is a really bold movement on your part that also represents all of us as women.
Yeah, yeah. And that's absolutely part of the mission behind it. There is so much silent suffering associated with the pelvic floor, with vulvovaginal symptoms. And a lot of that has to do with the fact that we have lived not so much maybe your generation, a little bit of mine, but definitely my mother's generation was, you don't talk about it. This is not something that we just put up with it. You carry on and you don't discuss it with a care provider. It's just the way that it is. That's what happens after you give birth. And now I'd say the millennial um, group of people have really been a positive force with getting information and just talking and saying everything. And then I'm kind of this sandwich generation between, I'm the Gen Xers, and we also now are kind of looking at, with social media and with all this podcast information, we are becoming informed as well, and also saying we're witnessing what's happening with our parents, and we don't want that. We want to stand up and talk about this. So part of using, it was a joke initially, but then I thought, I think I'm going to start calling myself this. And that part of the intention was to normalize a proper anatomical term and stop making it something that we have to hush about, and also educate, because there's also the silent suffering. We also don't know our own anatomy. A lot of people think the vulva is a vagina. And, so just naming things appropriately and standing in that uncomfortable space and showing people that it's okay to talk about, hopefully will inspire others to have conversations with their spouse, with their friends, with their care providers, with their mothers, so that we can lift this veil and help people understand that there's so many solutions that they can do easily on their own, but also practitioners who can help them as well.
Mm. It's a great name and good for you. I still think there is, you know, that element of a pause of embarrassment around
Mm-hmm.
using the word vagina. Like even with a gynecologist, I've noticed in the women's clinic, before a woman talks about her vagina, there's a pause there. Is this apropos? Am I allowed to say this in
Mm-hmm.
public? And then, of
Mm-hmm.
course, the term coach, most of us associate a coach is with someone who can help us. So a vagina coach is you're someone who can help us understand more what's going on with our, not just the vagina, but the whole pelvic system, which we're going to get into.
Mm-hmm.
So with all that said and mentioning all the different generations, how young, because I work with a lot of women and a lot of them at some stage or another ask me for help with their daughters, usually around hormones, PMS, whatnot. At what stage do you think is too young, or we should start paying attention to our vagina and our pelvic health?
I think as parents, if we have children, male or female, so just using proper anatomical terminology from the get-go is important. Then once we are, my one of my visions is that this is going to be taught in schools. So like I saw the childbirth video as part of my sex ed. If we were told about the importance of pelvic health, if we were told about pelvic floor physiotherapy, if we were told about the stages that as women we go through, all of which will have an influence to the pelvic floor: menstruation, sexual activity, pregnancy and childbirth. Not everybody goes, but still the majority of people do. And if we reach midlife, all of us will go through menopause, and those distinct phases uh, uh, will all influence our vulvovaginal health. And so if that seed was planted earlier in life, I think it would really change the world and end a lot of this suffering and put people in a position of power. I remember being in sixth grade, and a dentist came and a hygienist came to our classroom. We were given these little pink tablets to chew that would highlight plaque on our teeth, with the intention of them being able to then say, you need to brush and you need to floss and you need to come see us once a year. And so many people are conditioned to go see their dentist once or twice a year, even if they have no toothache or no issue. We just go because that's what you go see the dentist once a year for your checkup. And if we have that same PR for the pelvic floor, where we're told you go see a pelvic floor physiotherapist once a year to make sure that your muscles, your organs, like everything's working optimally, because the role of the pelvic floor is so central to so many things that we do. It's really, really important. So I think teaching it in schools is important. Pelvic floor physiotherapy, I would say around the time that you become sexually active would be a good time to start seeing a pelvic floor physiotherapist in person. There's a lot of people who, once they become sexually active, don't experience pleasure. They have pain, and that's not normal. Even menstrual cycles can be painful. That's also not normal. And we accept it as normal. And again, younger women experiencing this, especially for the first time, not knowing that it should be pleasurable, then also not knowing who to talk to about it, will just put up with it. And if they knew, hey, this is something to do with my vulvovaginal health, I'm going to go see my pelvic floor physiotherapist and see if they can help me understand what's happening. So I don't feel like there's a too young to be starting again with proper terminology and educating. My kids, I have two boys, but they've seen, my vulva puppet and all my paraphernalia since they were young. And I use funny terms as well, but I made it was very important for me that the kids learned proper anatomy, and we didn't hush about it. We didn't snicker about it. It's just, that's a body part, just like the nose or the elbow.
I'm just curious because I was going to ask you, obviously growing up in Ireland, we not obviously, but we probably use different nicknames or terms. So when I
Fanny
was
is yours.
growing up, we also had Mary. So
Oh,
your
Mary. Okay.
Mary was a more kind of polite, indiscreet way of talking about your lady parts as well was another one. What did Canadians have?
So down there, private parts, some
Mhm.
people say bits. I use, my program is Buff Muff, Muff Pink Purse. There's lots of different terminology, but I would say down there, or lady parts, or your bits or your private parts are
Yeah, we
the kind
had
of the
private
common ways.
parts too.
Yeah.
And in Ireland, so I had both of my babies in Ireland, two boys as well. And the only time I ever saw a pelvic floor therapist was within those few weeks post-pregnancy. And then I was never offered it for one after that. And then two, I never sought it because I was so young having both of mine. I wasn't educated in that aspect that this was something, and which is interesting because I trained as a personal trainer too very young, and then I trained as a Pilates instructor. And even in Pilates, as much as we do a lot of pelvic floor work, it was never the pelvic floor emphasis as a topic apart from the postpartum work.
Yeah. And I think I mean, that's how I started too. That was where the conversation really was starting, was postpartum. Then that's where I kind of said, well, hold on, if we know that pregnancy and childbirth are contributing factors, why are we not telling people beforehand? And that's where I created a program called Prepare to Push and wrote a book of the same title, trying to get this information about what the pelvic floor is, how we can train for birth, how we should be facilitating optimal recovery in those first 8 weeks postpartum. And then in parts of Europe, France is one, Germany, Belgium, everybody who gives birth has an automatic prescription to pelvic floor physiotherapy. It's something that's subsidized by the government. And here, so many people still don't even know, they've never even heard of a pelvic floor physiotherapist. So we have a long ways to go. But I do think that what's happening in other countries where it is part of postpartum care should be globally accepted. I think it's something that it would save healthcare systems billions of dollars. It would save mental health. It would save productivity at work. It would save marriages. Like it literally could change the world. But right now it's something that you first need to know about it. Then you need to seek it out. You need to have the means to pay for it, because it's not, unless you have, potentially extended health care. But not everybody does. So that's another barrier to care for so many people. And yeah, so I'm hoping at some point in my lifetime that I see it being adopted, that practice being adopted in all countries.
Well, hopefully, I and the other podcasters can help spread your word, but you're
Mm-hmm.
correct. Most people don't even know pelvic floor therapists are a thing. I said it to a client a few weeks ago, and she's like, I didn't even know that was a thing. I'm like, yeah, it is. And just before we move on, when I was pregnant, I was very young, like late teens, when I had my first baby. And I remember watching one of those videos of a lady giving birth. And it was the worst idea. It traumatized me. I was like, this is a terrible idea, and I couldn't get it out of my head. So by the time I went into labor, I was terrified.
Yeah.
So I would, not that I'm planning to get pregnant again, but I would never recommend watching one of those. They used to have British ones, a British birthing channel, and it
Oh,
was
wow. A
graphic.
channel.
Oh yeah, it was a whole channel, and it was graphic,
Wow.
and it showed you everything. It was like, and I was just, even now, I feel the trauma because I don't know. I thought it would help me, I suppose, like you at the time, but it just put the fear of God in me.
Yeah,
So,
yeah.
and then
Interesting. There's it depends on what you see and typically and I don't know what they were showing there, but they're like for instance, Ina
oh, it
May
was
Gaskin.
everything. It was the crown coming out. It was everything. You saw everything.
So I don't like sometimes I think it would be nice to have it categorized, but Ina May Gaskin, for instance, is a well-known natural physiological birth person. She's been working in the birth world for forever. Video, I didn't even know who she was. I'd never heard of it. So I looked same thing. I had this scarring video from I think it was sixth grade that just was like, oh no, I'm not doing that. And then when I was now working in the birth world and learning about these people and watching what Ina May's the videos that she puts out, that to me would have been very empowering. It was completely different from what I saw, which was the intention was to put fear and it was like birth control in a sense, right? Just don't do this because this is what could happen. Don't have sex because you could get pregnant. And so I think it's a matter of maybe knowing where to look to find videos that are depicting normal physiological birth without the interventions, without the scariness, without the because we see it on in movies and on TV, and it always looks like women are always screaming in pain, and there's always breath holding, and there's always backlying positions, and that's really not birth. So we need to start, obviously, or not obviously, we need to start sharing proper visions of what birth is. Excuse me. I
More
was sneezed.
realness, not just one side of it, all
Yes.
angles of
Yeah,
it. So.
exactly.
So with what you specialize in now is helping women with pelvic health, but do you find that more of your kind of clientele now, more people asking for help are more 30s entering perimenopause, or do you see a specific age at all?
Most of the people that I'm dealing with now are in the I'd say 95% of them are in the perimenopause, postmenopause phase of life. There's the odd person who is, who would have given birth, say, within the last year, but that's not as much who is attracted to me so much anymore. I think because I just don't talk about postnatal as much. I talk more about the perimenopause phase of life. That doesn't mean, though, that like the principles still apply. There's an immediate recommendation I would make for the first 6 to 8 weeks postpartum. But after that, the principles remain the same whether you gave birth 2 months ago or 20 years ago. So yes, most of the people I would say are in that later phase of life, and part of that is also because they have more money, they have more time. The problems are also probably either showing up for the first time or they're bigger problems. They've been maybe able to, you know, just wear a pad and put up with it for a while. But now that they've reached menopause and now they have this additional layer of change in the hormones, plus extra years of aging and muscle loss and all that kind of stuff, the symptoms become much greater. And so they're willing to take action now because people want to fix a problem that's interfering with the quality of their life. Most people aren't going to take steps to fix a problem that doesn't even exist yet, like to prevent a problem. And that's what I found with the pre-postnatal was they're kind of like, well, I don't have that problem. And there wasn't the motivator there yet. And so I feel like that's changing as well. More and more people know about birth prep and understanding the pelvic floor first, but it's still most of the people that I serve are in that later phase of life.
I'd wonder if there's an element of confidence as well there, that as we are shifting through mid 30s into 40s, our confidence does shift on some level. We're more confident to speak up and ask for
Hmm.
help. And like, I don't have to put up with this. And also that element of wear and tear as you get older, you're almost like, fuck this, I need to fix this, I need some help. Whereas when we're younger, we almost don't like to complain or speak up.
Yeah.
Especially with Canadians, I've noticed, because Canadians are super polite. Like, yeah, but so what are these women coming to you for? They're coming for incontinence? Are they coming for UTIs, vaginal dryness, painful sex, like all of the above?
I would say most people come for incontinence or organ prolapse. Those are the two things that would, I would say, get people in the door. And then they realize that, oh yeah, I also have dryness. Oh yeah, sex hurts. Oh yeah, and they don't necessarily group those all as part of the same systems.
Yeah.
They kind of compartmentalize, right? And so they come in not knowing that a lot of the other things that I talk about are things that they have been struggling with. Constipation is another one. They have no idea that, oh, the constipation I've been dealing with could also be tied to my pelvic floor, or maybe that's been part of the reason why I have incontinence. And so they start to put a lot of puzzle pieces together. But those are the two main things that bring people in.
What about back pain? How correlated is back and even like hip pain to pelvic issues?
Very correlated, but again, most people don't know that. One study by Dr. Sinead Dufour, who is a pelvic floor physical therapist and researcher in Canada, did a study that showed that just over 95% of women with low back pain have some form of pelvic floor dysfunction. Very, very closely tied. But again, most people, when they have back pain, they go to a chiropractor or a massage therapist or acupuncture or regular physical therapist, which all of those can absolutely be helpful. But so often the missing link is the pelvis and seeing a pelvic floor physical therapist and people coming into my program who, again, they will be coming in for the incontinence and then later as they've been going through a couple of weeks they'll say, hey, my back pain's gone too, and they don't realize that connection, but very closely tied.
Because most people, I think, when they think of back pain, they're either thinking of an external issue or there's some sort of spine issue, maybe a hip issue, but they're not thinking it's an internal issue per se. And even looking at IBS, diverticulosis, and stuff can cause back pain for a lot of people, but they immediately think, oh, I hurt my back twisting or something. It may not be that at all. And
Right.
I think like that alone, because so many women have back issues, well, that I speak to at least, like a lot, they go to see all these different practitioners, but they never think maybe I should have my pelvis assessed here and see if that's the problem, because it might be. And like you said, that could change your life and even
Yeah.
your marriage, your whole, all your relationships.
Yeah, yeah. And again, it's knowledge. They just don't know that that's even a healthcare practitioner that exists. And so, another reason why I recommend people see a pelvic floor physiotherapist once a year for that checkup, just like you go see your dentist, is to identify these challenges before they have become major issues. We can intervene, and if we see an organ is starting to shift out of its position, figure out why. And is it posture? Is it breath? Is it constipation? Is it the posture that you hold while you're sitting at the desk all day? Like, what is that? And let's address that. But now, also catching that earlier, we are in a better position to definitely prevent it from getting worse, and potentially improve it, and maybe even reverse it. But so often, again, it's this disconnect. We just sort of don't talk about it. We don't know who's there to help until it becomes a major issue where they feel or see a bulge at the opening of their vagina, or sex is uncomfortable, painful, or they now feel like they can't participate in any activity because there needs to be a bathroom close by and they're going every 20 minutes. That becomes life changing, right? Life altering. And so that's more uh, when they're more likely to take action. But again, we first need the awareness that there's who we would even see to get help.
Mm. You know, not to tell you all of my life stories back in Ireland, but one of my first jobs was working in a nursing home. this was probably quite traumatic in itself upon reflection. But, and I do want to go into the prolapse thing. There were several times, maybe with some older men with anal prolapse, but definitely older women. And I just, at the time, couldn't comprehend, like, how is this possible? How are your insides falling out? So I worked as a nurse's aide, and I would see the nurses, as gross as this is, people, sorry, push back in their insides.
Mhm.
And that if I had not worked in that environment, I would have never known that was a thing. And I'm sure there's people listening to us now that didn't know your insides can actually fall down and out of you. To put it in like a very simple term that people can picture, this can happen. And I think it stayed with me, again, not to get too graphic, whenever I'm on the toilet, I will always have this image that someday this could happen to me if I don't take care of myself.
Mhm.
So, what are all these different prolapses? Because there's not just one, there's a few, right?
Correct. Yeah. So pelvic organ prolapse, statistically, 50% of women who've given birth will have some degree of prolapse in their lifetime, and that risk increases with age. Increases with chronic coughing, increases with constipation, some links to poor posture, chronic heavy lifting. And it doesn't mean that chronic heavy lifting, if that's your job or heavy lifting at the gym is bad. We need to have a good lifting strategy, first of all. But what's happening is the bladder, the uterus, the rectum, sometimes the intestines can shift out of their proper anatomical position and bulge into or descend into the vagina. And this can happen to people who, I mentioned the statistic for women who've given birth, but it can also happen to people who have never given birth or never been pregnant before. Pregnancy and childbirth, especially vaginal childbirth, will increase that risk and can be, there can be disruption to some of the supporting ligaments. And sometimes all the exercise in the world will not fix that, but sometimes you can. If sometimes it's mainly muscle and posture and avoiding constipation, we can improve that. And sometimes people may need or choose surgery, but so often they aren't offered the other more conservative options first. And the people in the nursing homes, what I'm hoping is that there will be less and less of those people, or there will be people who have been given tools to manage that.
Mhm.
Vaginal estrogen is a big one. So many women, especially who were in the, my mother's era with the Women's Health Initiative that scared everybody off hormones. That's a whole generation of people that now have greater risk and have been struggling with pelvic floor dysfunction, with hormone disruption, with heart disease, with osteoporosis. So I think that that will hopefully start to shift in a more favorable way. Also, there's more people aware of pessaries. Pessaries are like an orthotic for your pelvic floor. There are companies now innovating with 3D printed personalized pessaries, which I think is a really, really amazing innovation in that space. And I feel like that's now, because pelvic health is so much more talked about, there is so many people who are now seeing how much of a void there is for options for people. So prolapse can really be pretty devastating to people. It really halts people in their tracks. It's very uncomfortable. It takes away your confidence from doing anything. You just sort of want to sit down and not move. But it's important to build up the musculature. It's important to do activities of daily living with a diversity of movement to make sure the pelvic floor can manage and tolerate those loads to prevent those things from getting worse or from developing in the first place.
It's a case of use it or lose it. Like
Hmm.
with your biceps, you don't move them, you're gonna lose your bicep muscle. But with so we have our birth control, and now with the pessaries and the other tools you promote, we have like prolapse control. That's what we call it,
Hmm.
PC.
Yeah, yeah, exactly. And there's, as I said, if you can eliminate your constipation, if you can stay hydrated, if you can optimize your posture, if you can learn how to lift appropriately, if you can train the pelvic floor to manage loads, then we so many people in my program have canceled their surgery. They didn't even know that they could do this, and they were just immediately sent down the path of surgery. And again, I don't want to take away from the fact that there are some people that need or choose to have surgery, and there's no shame in doing that. I just want people to make sure that they are prepared, that they have trained for that surgery, that they know how to recover, that they know that they need to do this for life afterwards to maintain that repair. There's a high recurrence rate with prolapse repairs. And I think a huge reason is because root causes are not addressed. If somebody has a prolapse mainly because they're constipated and they haven't addressed that constipation and they go have surgery, the likelihood of that surgery failing is very high. And so, again, if we could do more root cause investigation, address that, train the pelvic floor for the repair, and make sure that person knows what to do from a maintenance perspective, I think we'd see those statistics change.
Yeah, so it's not just a short-term fix. You have to do the post-surgery work as
Yeah.
well, as
Yeah.
you
Any
would.
other type of surgery has a rehab protocol,
Yeah, like
right?
heart disease, make sure you're walking, make sure you do this
Yep.
and that. So where does, because I know someone's going to ask, where do women who have had either a C-section or a hysterectomy fall into this? Are they still that same risk percentage, or are they higher or lower?
Hysterectomy higher, cesarean, they still can experience, the risk is a little bit lower. So there can be some, pelvic preserving
Because
that
they
would
never
happen with
had
this.
the push.
Right. Well, but some people have had a cesarean after they've pushed. So
Mm.
it doesn't, you can't just say, uh, if you've had a cesarean, you're fine. I could argue that, with a cesarean, there's multiple layers that the doctor will cut through to get to the uterus to take babe out. There then needs to be multiple layers of suturing and therefore then adhesions that result afterwards. And scar tissue is a major disruptor of function. And a lot of people post cesarean will deal with especially tightness and pelvic pain because there's been a disruption to how that core works.
Mhm.
And the pelvic floor is often the victim of trying to manage that load now all on its own until things have recovered. But not a lot of people even think of needing to recover or retrain that system. So, there is arguably a protective element to some degree if somebody, say, had a scheduled cesarean, but a lot of people will push for hours and then go have a cesarean, and that could, again, they faced the same pushing time, but they've also, regardless of how you give birth, you have the same postural adaptations, you've had the same hormonal influences, you've had the same changes biomechanically to the stretching of the abdominal wall, the weight on the pelvic floor. And then hysterectomy increases the risk of incontinence and organ prolapse, especially if the reason you had the hysterectomy was because of prolapse. The three top reasons for hysterectomy are heavy bleeding, fibroids, and pelvic organ prolapse. So 9 out of 10 are benign conditions, meaning not life-threatening. I guess you could argue maybe uh, heavy bleeding, maybe in extreme
Potentially,
cases
yeah.
eventually, um, but it's not cancer or something like that. And so, but people who have the hysterectomy, they think, great, just take it out. I don't need it anymore. I'm done having kids, or I'm never going to have kids, and that'll be fine. And so many people come to me and they say, if I had known what I would be dealing with now, I would never have chosen to have a hysterectomy.
Mhm.
And if you give women hormone therapy, progesterone, when they're like, a lot of hysterectomies happen in that perimenopause phase of life, where there's a lot of heavy bleeding that happens with that hormonal upheaval that's happening. And a lot of it is tied to low progesterone. I'm not saying that's going to solve everybody's issues, but again, if we can do more root cause investigation, why are you bleeding heavily? Why? What's contributing to fibroids? What has contributed to your prolapse? And address those first, maybe we could avoid that hysterectomy altogether.
Yeah, because to the hysterectomy should be a last resort, but for a lot of women, it's their first resort, or they'll get offered an IUD. So where does that come in? Does inserting an IUD, a foreign object, into the vagina cause tissue damage, encourage higher rates of prolapse and other issues because you're causing a hormonal imbalance? But not only that, this is a foreign object being put into your body. You're messing with the microbiome. For lack of a better word, you're almost scaring the vagina. Like, what is this that's in me
Mm-hmm.
and it's not going away?
Yeah, I mean, I want to just say that hysterectomies, like pelvic surgery, sometimes they are needed, sometimes they are an amazing option, and sometimes, like, I don't want there to be shame associated if somebody has had one or if somebody is thinking of one. I do want people to do the root cause investigation, ideally beforehand, train, and make sure that they're paying attention to their pelvic floor afterwards. From an IUD perspective, again, it can be helpful, but let's, instead of just with the conventional medical system, that's what our doctors are trained in. And sometimes we need that training. We need those options. They are not trained in root cause investigation. They are not trained in things like posture and breath and diet and lifestyle and exercise. So I don't want to take away from the fact that they play a role sometimes, and it can be a great role. But for so many, we're missing the true health. That I feel like we're in a sick care system, and sometimes we need sick care for our overall health and preventive medicine, and first line defense. I think kind of more the naturopath, functional medicine is better serving us. But IUDs can sometimes be the thing that stops the heavy bleeding enough for people to recover and move forward. There is no, not that I know of, any links to prolapse and IUD insertion. That doesn't mean that there can't be disruption to tissues for somebody who is perhaps not trained as well in putting it in. Um, I know that there historically has been no pain management offered. And now I'm seeing a lot more conversation around options for pain control because it can be quite uncomfortable having one put in.
Mhm.
Usually removal is a little bit easier. But anyway, yes, all the things that you said, it is synthetic hormones or non-bioidentical hormone. It can be disruptive, but it can also, in some cases, be a really good option. So I just want to make sure we stay balanced of it can be an option. It wouldn't be what I would recommend as a first choice.
Yeah. You mentioned something a couple of minutes ago, and I'm really glad you did because I'd like to draw attention to this. Like yourself, I mentioned I started off in personal training, and I'm sure you've seen how trends have changed over the last, let's just say, decade, well, at least 5 years, and all the Instagram influencers, which I suppose we both are ourselves, but there's that there's a huge trend now of girls, especially younger girls, lifting very heavy or pushing very heavy. And I'm not saying you can't, but at the same, because I do, I'm, as we say in Ireland, I'm a bitch for it. But I'm not saying you can't, but I have awareness from my own health issues and past. But a lot of these younger girls don't, and they're trying for heavier deadlifts and heavier squats and heavier leg presses, and everything's bigger, bigger. You can train like a man. Well, you can't for a start, so we need to shift that first. But there's miseducation there. It's all well and good wanting to look and feel your best, but we're missing that educational part, which I think we're not so much coaches are, we're educators. We're trying to teach people like you're maybe not considering this, or maybe you should try this. But with these pushes, there's so much pressure being put on the lower abdomen, all the internal organs, the pelvic system, that not only are you potentially putting yourself at higher risk for prolapse and pelvic issues, but you're also putting yourself, and this really kind of irks me a bit. I think that's a Canadian word. It gets to me a bit that yeah, we all want to push heavy, but nobody's saying like, are you considering how much pressure you're putting on the internal organs, but especially the intestines as well? Because with that contraction and pressure, your intestines are right there. And what do we see everywhere now as well? Good health issues, IBS issues, diverticulosis, which I have, and I know I have to be really careful with what I do with my lower body. And then I've spoken to women. A lot of women don't know you can get varicose veins in the vagina, in the vaginal canal, and they can stick out as well. And then women are seeing them, what's this coming out of me? And now they're thinking cancer or something worse. And I think we really need to add this into the conversation. It's all great wanting to be strong and healthy and look good, but maybe there's an upper limit there where we should say, hold your horses now. You don't need to do a 400-pound squat or deadlift. Like, and again, I've done it, like I know, but I see this as a concern because especially in, like the early 20s for sure, all over Instagram. Where are these girls, women going to be in 10 or 20 years?
Mhm. Yeah, I think there has been a masculinization to some extent in fitness and I'm all for not like I don't think we should have pink weights and only be able to do the small,
Yeah.
the small light weights all the time. We should and we benefit from lifting heavy. However, again, back to if we educate our kids beforehand, if we include pelvic health into another muscle group that we learn when we're going through our fitness certifications and personal training, then we'll start to have this infiltrate into fitness classes and personal training sessions so that we build the tolerance. Like we are building tolerance in all the other muscles and with no awareness of the pelvic floor. And the strategies of lifting for many people is a bearing down or a Valsalva, which, and using weighted belts and all sorts of things, which can help to some extent. But without the awareness of the pelvic floor, it can be that constant pressure on that. And at some point, something's got to give. And you will never know. There never will be you can't lift if you're a woman, you can't lift anything over X pounds. What's heavy for like you said you said 400 pounds. Like I can't even fathom lifting 400 pounds. That would be impossible for me, but you've done it. And right. And so,
Yeah.
and you didn't come out of that on the other side with an issue per se. Maybe if you did that regularly,
In my
maybe,
younger
but
years, I didn't, but in the last year or two, I'm sorry to interrupt, but
no.
I've noticed I can still lift, but maybe it's not a good idea. I can feel the pressure in my pelvis. I can feel when I will get a diverticulosis flare
Yeah.
from a heavy leg press
Yeah.
because of all that pressure bearing down. And I've speak to my clients that if you do have these issues, I try to curve the spine a little bit to protect the intestines when doing leg presses like that. But that's not stuff that education is not mainstream, and I would only know it from being in the position myself.
Right.
But I can still do it, but it doesn't mean it's a good idea.
Yeah. Yeah. And we have to factor in aging. We have to factor in age-related muscle loss, bone loss, hyaluronic acid, collagen loss, like all the things. So there's benefit when we're younger. We have more resilience, maybe before any childbirth or what have you has happened, where we can get to the point of building our peak bone mass, which is around 30, between 30 and 35 years of age. However, I agree with you that it's like, okay, at what point is this going to be too heavy? And are we going to start seeing an increase in pelvic floor dysfunction? Like we already have seen incontinence is high. Anal incontinence is very common in runners, younger runners. Their prolapse and incontinence is common in the CrossFit population. Again, doesn't mean CrossFit's bad, but let's build in preparation, like we're going to prepare for birth, like we're going to prepare for our surgery. Let's prepare for our workouts, prepare for this, whatever goals we have, with an awareness of optimizing our mobility, our flexibility, our foundation, which is the pelvic floor, and bring that awareness into our lifts. And with that awareness, some people may not even associate that pressure that they feel as something that could be harmful. They just think it's pressure right now. And there are other people who could do it and immediately have that prolapse happen right on the spot. And then they're shocked, like, what the heck just happened to me? Um, there was an interesting study that looked at the study was not specific, like this was a subset of a bigger study, but in this subset, there was women with prolapse, and they looked at uh, medium, like light, medium, heavy. And the heavy load, I believe, was over 50 kilograms. So that's a heavy load. And they had fewer prolapse. These are all women with prolapse. They had fewer prolapse symptoms than the women lifting under 15 kg.
Do you know what
So
the exercise was?
I'd have to go back and look at those parameters. I don't remember which ones they were. So we can't just blanket statement say there's a certain limit of weight. It's going to be relative to that person, their strategy, their symptoms. And again, when we hopefully down the road have all personal trainers have education about the pelvic floor, all fitness classes talking about pelvic floor, bringing that into the conversation, there will be a more global awareness about the importance of making sure you understand the limits, not just as a number, but as how is your body responding and do you have the capacity to manage that load? Um, so, and especially as we're approaching menopause, when we are now dealing with the hormonal decline, and we can look at from a menstrual cycle perspective, during ovulation, when our estrogen is highest, that is where we are best to do our heaviest lifting and our more intense activity. The week before, when our estrogen is dropping, the week before our period starts, we are in a low estrogen state. That's mimicking post-menopause. It's also what happens postpartum when we are in that low estrogen state. We are going to be, most people are more symptomatic, and that's not the time to be doing our heavy lifting. So, again, we could argue, okay, we reach menopause, we're in that low estrogen state. Many people will supplement, but it still doesn't bring us back to where we were during our fertile years. So, I do think like we need heavy lifting, we need impact for our bone health. That's how we are going to prevent osteoporosis. But there is, and we, again, there's never going to be a limit, but we have to have that personal awareness as what feels appropriate for our bodies and our capacity to manage that pressure.
And understanding, as you alluded to, that it's not linear. The same with nutrition, that
Right.
as you age, as much as we would like to keep everything the same and still eat what we did in our 20s, we
Yeah, we
can't.
have to change.
It has, and the workouts, and again, I'm a bitch for this. I want to keep my workouts. I love my workouts, but I've came to a stage where I accept I have to start swapping out a few things. I have to start looking at alternatives. And circling back to the education, a lot of women just don't know this. They don't
Yeah.
know. We know we're changing, but we don't know we also have to change the external factors as
Right.
well.
Right. Yeah, I
Before
hear
we,
all the time people are like, I haven't changed a thing and I'm
and
gaining
that's the
weight and
problem.
the exercise exactly. And that's the whole thing is as I said, I was going through perimenopause. I didn't know what the heck was happening to my body. I didn't know the term perimenopause, and I eventually figured it out. But there was a lot of it was a shitstorm. It was an upheaval, and I didn't know what the heck was happening. And I was doing all the same things, thinking, well, why am I now all of a sudden constipated? Why am I all of a sudden not sleeping?
Yeah.
Why am I all of a sudden having murder scene periods? I didn't change anything, but I needed to change something.
As
A
we
lot.
leave this, yeah, as we leave this topic, I just want to shove it in here. Because I want to catch you on one more question before we wrap up. But we've been focused very much on females, on women. Men can have prolapse too. It just may not be as obvious as a woman's. Am I correct?
Men can experience so hernias, inguinal hernias, not that women can't have that as well, but it's a hernia is kind of like a prolapse, and men can also experience rectal prolapse as women can. So rectal prolapse is where the rectum bulges out the anus. So again, that can happen in male or female anatomy. In bladder prolapse, in a rectocele, and in a uterine prolapse, in males, obviously they don't have a uterus. They also don't have a vagina for things to descend into. So yes, they can, but it's different than the prolapse of females.
The one last thing I want to touch on while we've still a few minutes, is something that comes up a lot. And more common now, I feel, probably, I mean, this is debatable because our stress is higher than ever. I mean, I didn't live back in the 1920s. Maybe it was just as bad then. But vaginal dryness and tissue regression seems to be on the rise. And I think it's not just the changes in hormones, but then you've got the bigger stress component there, pulling blood flow away from the reproductive organs. And as well, if you're stressed, the last thing you want to do is have sex. And that goes back to the use it or lose it aspect. If you're not having sex, you're kind of not doing yourself any favors there either. But what do you like to do for women that come to you needing help with vaginal dryness and painful intercourse. And even if they're not having intercourse, that tissue regression, like it can be very painful for women just sitting, doing
Mhm.
nothing. I don't think a lot of people get this. It can be like sandpaper tearing, like to
Yeah.
give people a
Yeah.
visual.
Yeah. So vaginal estrogen is I would say is the gold standard and what I would recommend. Vaginal moisturizer as well. Um, excuse me. Hyaluronic acid is something that we produce in our bodies, but produce less as we age, as same with collagen. And so supplementing or using a vaginal moisturizer that has hyaluronic acid can be helpful and beneficial as well. Vaginal DHEA is also, it's not a hormone itself, but it helps our bodies convert our own hormones into the beneficial hormones that we need. So vaginal DHEA can be helpful. But you mentioned blood flow and circulation, which estrogen can help with. Also, our posture through the day. We spend a lot more time sitting than we have in decades before. We don't move as much, and movement is what helps with blood flow and circulation. So if we're stagnant, that's going to also stagnate other tissues. Our posture, the diet, eating more processed foods. So what are we actually consuming that is supposed to give us building blocks to help with tissue repair, tissue health? If we aren't consuming the raw goods that will help us build, if we're not absorbing the nutrients, so if our gut health is off and we aren't absorbing, even if we could eat the healthiest diet in the world, but if we don't absorb the nutrients, that's another issue as well. Um, but clothing, even we could argue like forever chemicals that are in clothing, also incontinence pads can contribute to dryness. So people who are using pads to mimic their leaks, and it's a bit of a oxymoron. They're leaking urine, so they feel this wetness, yet it's contributing to dryness in the tissues themselves. Tight muscles is also something else where again that's going to restrict blood flow and circulation and also make sex painful. So the tissue component can be contributing to pain. The muscles themselves and how much tension they have can also be contributing to pain. And even if somebody has had one traumatic or painful or uncomfortable situation, the thought of it being the same the next time, even if the muscles were in a better position, more relaxed, even if we had supplemented with estrogen, sometimes the thought of something being painful can contribute to discomfort as well.
Mhm.
So again, you can get screened by pelvic floor physiotherapy. If you are approaching or beyond menopause, or if you're newly postpartum, I do recommend vaginal estrogen, potentially vaginal DHEA if you want to supplement with that as well, and then a daily vaginal moisturizer.
Do you have a moisturizer you prefer? I'm assuming it's a clean one, not full of chemicals.
Yeah, I'm actually formulating my own. I'm awaiting the samples of the one that I'm hoping to put out on the market. Right now, I also really love Feel Amazing from my friend Shirley Weir. She's the founder of Menopause Chicks. I really like hers. It's a little gel, very easy to put on, not sticky, not messy, not goopy. I really like that product. Good Clean Love, Reverie from Bonafide. Um, Anything with hyaluronic acid, and it can be a gel, it can be an ovule that you insert, can be beneficial. So those are a few of my favorites.
What do you think of Dr. Annika Becca's gel? Does she
Love
have
hers.
a
Yeah.
vulva gel as well?
Yeah, so that's a DHEA. Unfortunately, it's not available in Canada. She can't ship it into Canada, even though DHEA is something we can ask for a prescription for from our doctors. It's bonkers that we can't buy that from her, but she's a friend of mine. Her product is amazing. I do love it. So if you're in the States or if you know somebody who can purchase for you, Jelva is it is a vaginal DHEA
Or if
cream.
you have a PO box, because a lot of my clients do have PO boxes
Yep,
in like
yep,
Montana and Idaho.
yep,
So where
yep,
there's a will, there's a way. Us women
yep.
are quite creative.
Yeah, exactly.
So do you have any last words of wisdom for all of our listeners and probably mostly women, but hopefully some men?
Yeah. Yeah, I would say it's never too late to start paying attention to your vulvovaginal health. And once you address, it can seem sometimes overwhelming when you think of this list of things that you need to address. It can seem like a lot and it can seem like you're adding things to your to-do list. I think it's adding to an opportunity list where once these symptoms are less bothersome or gone, all the other things on your to-do list then become much easier. And you also then can, your life becomes bigger again because you can do all the things that you have potentially been avoiding because of your pelvic floor. So never too late. I have a woman who's 93 in my membership. Lots of women in their 70s, 80s who, again, have gone through. I hear every day that we do a Wednesday wins, and today was looking through all of them. Somebody who'd been to multiple physiotherapists, multiple doctors, and she's done the 28-day challenge and learned multiple things. Plus, she does a 10 to 15-minute workout every day. And within, she's, I think, a week away from finishing. And she's like, I don't have any pain anymore. So change can happen. We always have the capacity for change in our bodies with the right information and with the right nourishment. And I don't mean just food, like nourishing information, nourishing movement, nourishing sleep, nourishing food, nourishing products. And so, yeah.
I like the one quote that resonates with me that I like a lot is health is our most undervalued commodity until
Yeah.
it's gone. And that
Yeah.
really is what you said in the beginning. Most people don't take action until they don't have it anymore. They're having
Yeah.
an issue, which is unfortunate.
Yeah.
So, Kim Vopni, people can follow you Instagram, the Vagina Coach, your website, the Vagina Coach. You have another website called Buff Muff, if I'm correct.
Yeah. Yeah. My main website is vaginacoach.com. My handles are all Vagina Coach. And buffmuff.com is specific to the Buff Muff method, which is my kind of the fundamentals of pelvic floor health that get people started in understanding all the things, not just exercise, not just hundreds of Kegels a day that you can do.
Yeah, that's the one I said. Two of my clients had recently purchased their sisters. They're doing it together, which is interesting. Maybe I'll get my sister to do it with me.
Awesome.
Well, thank
Thanks
you
so
for your
much.
time, Kim. I really appreciate this. This was a great, very helpful, informative conversation. So thank you.
You're welcome. Thanks so much for having me.